Welcome back to the Groove Podcast, brought to you by none other than the mighty Sigma Alpha chapter of the Omega Psi Phi Fraternity Incorporated. I am your host, Paul Wilson, aka DJ Population Spring 21. I have with me my brother, Mr. Lawrence Charles, Spring 17, and also brother Brandon Fennell, Spring 19. Gentlemen, how you doing?
I'm good. How are you?
I'm great, man. How you doing, brother Charles?
I'm doing well.
Yeah. All right. So we have gathered here this afternoon to talk about something very important to the world, but also very important to the Sigma Alpha chapter as well. And that is the recognition of World AIDS Day. Every year, December 1st, or somewhere in December, we make sure that we bring recognition back to the conversation of World AIDS Day. So, Brother Fennell, tell me why World AIDS Day is important.
World AIDS Day is important because every year on December 1st, we commemorate the worldwide response to the HIV and AIDS epidemic. And so here at Sigma Alpha, we want to bring notice to what is actually going on, because a lot of people aren't talking about these things. And it is something that really plagues our communities, and it affects over 36 million people in the entire world and over 700,000 people in the United States. So this year, the World AIDS Day, their theme is equitable access, everyone's voice. So it highlights the government's response to and their commitment to ending the HIV and AIDS epidemic that is plaguing our world. And so as a Sigma Alpha chapter, we've been doing things for years to highlight what's going on when it comes to the HIV and AIDS epidemic. And so my brother Lawrence Charles, he can give us a little bit more history of what we've done in the past to make sure that our community is aware of what's going on.
Brother Charles, tell us what the Sigma Alpha chapter has done in the past to bring awareness to World AIDS Day.
In the past, what we've done here in our chapter is we've gone out to the people. We've passed out condoms, passed out pamphlets. We've brought the information to them in the streets. And that was pre-pandemic. As far as what we've done, in my opinion, what's been very impactful in this chapter is we've partnered with the alumni chapter for Delta Sigma Theta in our area.
Okay.
We've held a forum. We've invited politicians. We've invited AIDS survivors. We've invited health resource officers. We've put all those people in a room, and we talked about the disease. We've talked about how people are living with the disease. We've talked about what the disease has done in our community. And I feel like this has been the most impactful because we've gotten to see people who are struggling with the disease, people who are thriving with the disease. And we've gotten to hear their point of view. We've gotten to hear how they're living day to day. One of the most impactful stories that I've heard is about 3 years ago, we had a young lady. She was suffering. Well, she survived the disease. She was born with it. She's gotten the disease through her parent, her mother. And she has the disease, AIDS, and she has been able to live with it. She's been able to go to school. She's been able to have children. She's married to a partner who does not have AIDS. And she lives every day her life knowing that her disease is there, but she's able to continue and go on.
Well, she's a walking testament to how you can survive with AIDS, and it's not the death sentence that it once was. And to that end, it seems as though Sigma Alpha is still carrying on the trend of bringing awareness to this conversation. And our guest this evening is going to help us do that. And we have Miss Monique Simon here, and she's representing the Association of Black Social Workers. And Ms. Simon, I want to ask you a question. So back when I was growing up in the mid 80s and in the 90s, you know, this conversation was extremely prevalent. You had PSAs on television every 30 seconds. You had celebrities doing commercials and things of that nature. You had specialists in schools having these conversations, handing out contraceptives, making sure that people were aware of how important it was for them to know their status. And then it seems as around, late 90s, turn of the millennium, this conversation went away. So I want to ask you, Miss Simon, did the conversation just go away, or did the disease go away?
I would say the conversation, especially the conversation where it involves isolation, stigma, and the fact that, it's lead to the accusations of alleged high-risk behavior. So when you have an epidemic like this that's been around for since the 80s.
Yeah, decades.
And they want to say, oh, it's risky behavior. So why talk about or have the fact that, oh, you have this disease, it's here. What did you do?
Expound on what you mean by risky behavior, please, Ms. Simon.
The risky behavior would be the same sex, the drug use, the
like sharing hypodermic needles,
yes,
that kind of thing.
Yes, and just being in the the crowds where you're doing activities where it involves unprotected sex. And the next stigma comes to the fear of being isolated, losing your partner, having the fact that you are disowned by your family, or having the risk of possibly losing your job because of your status. All of that connects with mental health. So why have a conversation about it now when we are having more cases, when you have more to lose, where that awareness is there, but the fear is higher?
So talk to me about the trend of not being tested, right? Because, you just talked about it, right? You talked about all of these potential ramifications. If my status is known, I could possibly lose my job. I could possibly lose my significant other. I could, and so is there a trend of individuals who may be getting tested, but not necessarily sharing their status?
I could say there's a huge trend. Not sharing with the people you love and just saying to yourself, oh, I know, but I don't want everyone else to know. It's more of I'm not telling because I don't want anything else to happen. I already lost myself. So if I'm losing myself, I can lose everyone else. No one wants to risk that. And now you're thinking, am I going to live? Am I going to die? Can I live with this? That fear alone will cause you not to let anyone know.
Well, we know specifically here in South Florida where we live, right?
Mm-hmm.
Where the numbers are through the roof. Whether people are having the conversation or not,
Right.
the numbers are the numbers. And we know that we have a large population of, Caribbean American people here or people of Caribbean descent here in Miami. And I want to ask Brother Charles, is there a stigma in the Caribbean community around AIDS, HIV, getting tested, knowing your status that you can pinpoint or talk about?
Well, the data that we took a look at doesn't specifically separate us in terms of Caribbean, African American, or whatever. But
just in the circles that you run in, is this a prevalent conversation still?
But what the data do show is that down here in our area, South Florida, is that the number is increasing.
Yeah.
And in terms of the conversation around the community that I'm part of, the Caribbean, the African American community, is that getting tested is something that we do not want to do. Is that we are afraid that once we know that our life is over. But when you look at the opposite of that,
Correct.
when you do get tested and you do know what your status is, that is the best thing to do, because then you can start your treatment. Early detection is the key when someone finds out that they're HIV positive or they have AIDS. The earlier you know, the sooner you can get the help that you need.
And also the fear of being shunned. In the Caribbean culture, you will get, based on my experience as a social worker, you will get, we don't do those things. How could we get those things when we're church going, when we're active in our community? And people that do that, they have something where they weren't raised the way we were. So it's more of, okay, we're going to accuse the other African-American culture,
right,
and not the Caribbean culture for the high-risk behaviors.
right.
And that's very, scary, because as a social worker, I would get I'm in denial. And that does happen when you do find out that you're, HIV positive. Then I will get the anger. Then I will get to now, okay, I didn't get this by risky behavior. I got it another way. It could have been, my parents. It could have been where it was in my neighborhood. Something happened, not the risk behavior. So you disassociate yourself with the fact that you were having high risk behaviors or something happened that could have been traumatic, like sexual abuse, which does happen in the Caribbean community.
Right.
And that's something also that they don't talk about, where HIV is high, it's transmitted, especially what's going on in Haiti now.
Right. So I want to switch gears, really quickly and kind of talk about this conversation amongst young people, right? I mean, I have a 15-year-old son. I'm always around young men, and he's on the basketball team. So I'm constantly talking to young people, right, between the ages of 14 and let's say 18. And I can say that very many of them are sexually active, right? But the conversation is not revolving around HIV and AIDS. I don't even know if they're aware of what that is and what it has done to the community. So my question to you, and I want to ask Brother Fennell too, because I know that this is something that Omega Psi Phi has been talking about for a while, especially in our Sigma Alpha Lamplighters program, where Brother Fennell is one of the facilitators of that program. So I want to ask him and you, like, what can we do to engage our young people in this conversation again so that they understand the importance of knowing their status?
The first thing I would say is building a rapport with them. You have to make sure they understand that you're here to support them, and you normalize that conversation. When you throw at a conversation like that at a child, they're not going to be prepared.
Right.
Normalize it. Make them feel comfortable enough where they can ask you questions and feel like, I want to learn more about this.
Without the judgment, without the ridicule.
No bias, no nothing. If they're coming to you for that support them. Listen first, encourage, motivate, educate. Then you go back again, listen, encourage, educate.
Brother Fennell, the Lamplighters always encourage the young men to maintain a healthy lifestyle and make healthy choices. Like, how can we, ensure that they're aware that this conversation is taking place?
Well, one, as adults, we can't be afraid to have these conversations with them because we feel like they're too young to have these conversations, but they're really not. Because as you stated earlier, teens are becoming sexually active younger and younger every day, and it's important that they know and they're aware of the dangers of unprotected sex and sex in general, because we know that condoms are only 99.9% effective. So that 0.1% can still, leave room for other STIs and even, worse, HIV and AIDS. So we have to, like she said, we have to build a rapport with them to make them feel comfortable. So one thing that we always emphasize to our young men is to be comfortable with us. If you're not comfortable, let us know. But we're not afraid to have these conversations with them because it's real life. We don't want them to go out into the world unknowingly partaking in these things and not know the risk of them. And so we just make sure that they're well prepared once they leave out of, our care, that they're aware of the different effects and the risk of risky behavior and things like that. So we don't shy away from these conversations just because of their age. We tailor them to their age group. So, because they're not, some of them aren't mature enough to handle it, but we make sure that we are careful in our delivery of that message.
So, to bring our conversation to a close and kind of tie a little bow around it, right? We talked about education. We talked about engagement, right? We talked about making sure that everyone around us and the people that we care about know their status. So if there was a message that you wanted our listeners to walk away with at the end of this podcast, what would that message be? Your battle, it doesn't have to be alone. Why? Because that social support is very important. As soon as you know your status, get mental health, because mentally you start to change. Your environment, everything that you processed that day before you were, know your status, it's different from the next day. So get that mental health and put it in place and continue that service. And with that said, I want to say on behalf of the Omega Psi Phi Fraternity Incorporated and the brothers of the mighty Sigma Alpha chapter right here in Miami, Florida, on behalf of Brother Charles and Brother Fennell and our illustrious president and CEO and basilisk, Brother Mahmoud, we want to say thank you for joining us and sharing in this conversation with us and helping us bring recognition to World AIDS Day and making sure that the people in our community know how important it is to know their status and to have the conversation. Thank you. I appreciate you coming out.
Thank you for having me.
Absolutely. And on behalf of the brothers of Sigma Alpha, until we meet again, it's your host, DJ Population, a.k.a. Paul Wilson, Spring 21. You've been listening to The Groove.